Well, Marilyn, we're continuing our conversation with Marilyn Watson, whose daughter Michelle is had an early onset breast cancer. They missed the diagnosis, and unfortunately, by the time the diagnosis was made, she had metastatic disease. The book that I'm writing that kind of deals with these issues of early detection is dedicated to the memory of Michelle, because having a girl at 22% with a breast lump is a great opportunity to catch cancer early and save a life. But in Michelle's case, there were delays. Now, since that time, you've developed Michelle's Place. You're out there serving the community. You're investing your hard-earned hours to support this program. Your heart and soul is behind it. You're passing out expensive educational material. And I understand that you were getting some support from Komen. Is that right?
Yes, they did give us grants, and we they gave us for the breast health. If someone needed the diagnostic work, they did that for the longest period of time for us. But we also did educational grants from them, which went along fine for a number of years. And in fact, we used their breast self-exam cards that they printed. And then we wrote for a grant, and they said, well, you have to take the self-exam part of it out, because we do not feel that this is a wise decision to have women doing their own exams, and so we don't think you should be doing that anymore. So you need to take it out, or we can't give you the grant. So we feel very strongly that it is essential that women do their exams. And many of our women have come in and have found their lumps.
Absolutely.
Either themselves or their partners have found the lump, and that is why they've come to see a doctor. And so we felt it was more important to bypass the grant.
Told them to shove it, is what you said.
Well, not that.
Okay, I know you would. But here's just unbelievable. More than half of all cancers present as lumps, and 90% of the lumps are found by the women. And it was usually, we have countless examples of women finding small cancers. What we need to do is teach women to do self-exam more effectively. So what we should be doing is educating women how to do proper self-exam. But along comes Komen and the American Cancer Society, and they use some very faulty thinking, saying, well, there's no scientific proof it works. Well, I'll tell you what. There will never be scientific proof. You can't isolate self. It's a layer of protection. And we've learned by teaching people to do it properly, actually the way the American Cancer Society suggested. My wife has taught the classes for years until ACS and Komen said, oh, it doesn't work, you don't have to do it. And then people stopped coming to her classes. So it was really kind of tragic that so some women out there are doing it, they're doing it well and catching early cancers, but they're getting this confusing information from Komen to say that A, you don't need to do self-exam, but B, be self-aware and report a change, because it might save your life. I can't interpret what that means. To most women, I think it means forget doing self-exam, it doesn't work, and I don't like doing it, I'm full of lumps anyway, and why should I invest the time and efforts to learn to do it properly when people are telling me it doesn't work? So I don't know what the answer is. I don't know what the motivation behind it. I think they've got a committee that's got a lot of scientists on it, and these scientists say there's no scientific evidence. Well, there's a lot of things that we do in life that have practical decision-making process that aren't based on pure science. You have to use some common sense. And if you find a little bitty cancer on breast self-exam, you go to the doctor, you make a diagnosis, get the ultrasound, you may well save a life. Yes, it's not perfect. It's a layer of protection. And the better it's done, the more effective it's done. And that's why our Be Aware Foundation has a video, and we'll have a link to that video where any woman who's interested in learning how to do self-exam with confidence can watch that video. Marilyn, I think you need a Nobel Prize in medicine here. I mean, what you're doing for the community, the lives you've saved, the stress you've reduced, it changes, you've helped people survive, it improves their immune system. And Michelle's Place is a wonderful place, and I think we'll have a link to Michelle's Place if people want to know more, or they want to donate and support their efforts. But I'm just overwhelmed at what you did with Komen, because it's so hard for a nonprofit to survive and meet your mission. And here's somebody offering you grant money, but in your heart of hearts, you know they're telling you to do the wrong thing.
We feel very strongly that everyone should be doing self-exams and that they should be getting their annual mammogram.
You're absolutely right. And this is what amazes me is that an organization like Komen, with all the public funding they get, can come up with a statement that breast self-exam doesn't work, but you should be breast self-aware. I mean, this is ludicrous. I can only assume that there was a committee in Komen with a whole group of intense scientists who said, we lack scientific proof it works. And the other half of the committee says, yeah, but it kind of practically, it works if you find a small lump, it's bigger than finding a large lump. Well, this was kind of a compromise statement by Komen, but what it does, it tells women that breast self-exam doesn't work. I don't like doing it. It makes me nervous, and therefore I now have an excuse not to do it. This is a real problem. There's no question in my mind that diagnostic delays will occur because of this. When there's diagnostic delays, we see the need for more aggressive treatment, more chemo, more radical surgery, radiation. But what the bottom line is, with some of these diagnostic delays, these women aren't going to make it where they would have made it. They would have survived had they been diagnosed early with self-exam and a proper workup. But by diagnostic delays, by the time the woman comes in, as in part like Michelle's case, she's got metastatic disease or stage 4, and best we can do is have them live a bit longer with aggressive chemotherapy. So we can't let that happen. Women are going to have to fight back. I think they ought to look at Komen Foundation and ask for an explanation. There's something going on that's wrong there, and we need a better recommendation than be self-aware, but you don't have to do self-exam, and to report a change. How are you going to report a change if you're not doing the regular exam? It just doesn't make sense.